I was going to have an X-ray done on my stomach, the hospital guy asked if I could be pregnant. I said no. They said they were going to do a pregnancy test anyway.
I had an abscess that got very infected and I was at a high risk of going septic. I wasn't told what was happening at any point. Nothing ever got explained, or and I didn't know what was going to happen. I didn't have any people just sitting down to talk or anything like that. None of the nurses really spoke to me. None of the doctors really spoke to me, and it was just a horrible experience, even beyond the sort of illness that got me there in the first place.
I'd been there 2 years before this time, and I had had exactly the same symptoms I had been admitted for this time, and I had borderline cancer scare, and nobody even opened my notes and checked my notes. It wasn't until I started having fits again that all the doctors then came down to the ward. I was so scared that it was going to start over and over again.
Of course, I had some dental work done on my mouth, which I asked the dental department, did they require me to bring my own staff in? Because the carers know how to put the sling under your bottom and secure the sling so it's safe and secure. They said no. The hospital staff on that day had only done the training the day before to do hoist training.
Frustrated, but they sort of just listened to me.
Not that I was in any danger of falling, that's not the point, but when your bottom hangs out the bottom of the sling and it's not positioned comfortably enough.
At one point I was convinced I was just going to die and no one would notice, really.
It was quite difficult to understand sometimes what was happening, and I felt really alone and really scared. If they'd have listened to me in the first place, I wouldn't have got so frustrated and felt like they weren't listening to me.
Which would have been better if they had have gone, yes please, that'd be lovely, because at least I would have had the safety side of my own staff, knowing my routine, to be consistent, to help me with any care I require.
I wanted them to really listen to me as a proper human being and as a whole, because they have a medical checklist and they ticked every box and thought that I was fit to leave. My medicine wasn't working properly or something wasn't working properly, and I just knew that I needed extra help.
The most important thing is a really simple thing, and it's just talk to me. Explain what's going on and what's going to go on. I mean, it's easier, it's better still if it's like simple language, if it's explained clearly, if it's explained in a way that's easy to understand. But a big first step would be just talking about it at all and communicating that information to me, because it doesn't always happen, especially not in sort of emergency situations. And I know you're busy, and I know it's a demanding job and you don't really have much time, but just take a minute or two out. It's especially important to me because, like, I am autistic and I do panic a lot if I don't know what's going on. But I think it would help anyone, really, just to have an idea of what's going to happen. Well, especially for disabled patients, don't make assumptions. Don't think that because someone's got an entirely sort of flat effect that they don't have a mental health problem or they're not in pain, which both happened to me. Don't do things like assume if they've got a support worker with them, or if they're using assistive technology, that they won't understand what you're saying and you won't need to talk to them. Just try and think a little bit beyond that.